And welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the Team Needham Abode podcast studio. And we are super excited to be talking about why there is no such thing as good health insurance in America today, at least not in the typical sense. And I'm going to start with a little video that I did a few years ago to show you why this is true. While I'm getting that video prepared, Janet, tell us a little bit of what your thoughts are about health insurance.
Well, health insurance in the United States has morphed into something that insurance isn't true to itself. I mean, health insurance used to be more for catastrophic reasons versus covering everything that really should be out of pocket. So it's no different than saying that, everything should be covered. And really, that's not what happens when you buy an insurance policy. So if you bought insurance for your house or your car, they're not going to pay for the incidentals. It's going to be if there's something catastrophic or major that happens. And that's the purpose of insurance, is to cover things that are out of your norm, that is going to not put you in bankruptcy.
Right. So watch this video and then we'll discuss afterwards.
6 months ago, I was driving home from work at night and got into a pretty serious car accident. I was pretty banged up and the car was totaled. Good thing I had good auto insurance and they paid for everything. Even though I am healthy, like most people, I still have insurance to cover me for unexpected events. But a few days ago, while shopping for tires, I had an epiphany.
Those are some great choices of tires. So how soon can you get me in?
We can probably get you in tomorrow.
Oh, that's awesome. Okay, so what is the price going to be?
These tires are going to run you about $1,400.
Whoa. I wasn't expecting that. I should not have to pay for these. My employer's auto insurance should pay for these. Gosh.
I think we're having some audio issues on that video. I'm not sure why. So I'll have to check into that, and I'll put the links in the stream. But basically what the video states is that it's when we first started insurance, one of the first examples that I know of, I'm sure there's examples before this, was insurance was started when the ships across the Atlantic were crossing from England to the new colonies. They'd often sink. And when they did, there was cargo on board that was super expensive. So they had Lloyd's of London was one of the first ones that I know of that had an insurance policy that would cover those things. So for catastrophic type things. The insurance industry has obviously progressed since then, or regressed, however you want to define it. But healthcare is definitely a different animal when it comes to insurance, because it doesn't cover just catastrophic stuff, at least not in the traditional sense in the United States. And when we go into the history of health insurance and how it started, especially employer-sponsored health insurance, here's how it really started, is that it started back in the 1940s when during World War II, and President FDR made an executive decision. His executive decision was to put a wage freeze, put on a wage freeze. And what he did is he said, basically, he made a list of jobs and what they should be paid, and they can't go any higher, because he was concerned about wage inflation or just inflation in general. Well, as is per usual, anytime the government gets involved in free markets and sets wages or sets things like that, there are unintended consequences. And the unintended consequences, that's how health insurance came about. It wasn't because employees were asking their employers to start paying health insurance. It was because the employers couldn't pay them any more money. So the employers would go to the person and offer them health insurance. And it was typically hospital insurance at the time. So, the economy was booming. So let's give some examples like General Motors and Ford. They were building tanks and bombers and all kinds of airplanes and all things to support the war effort. So when General Motors would need more people, and if they were already working at Ford, they would say, well, I see you're on the assembly line at Ford, and we can't pay you more than XYZ per hour, but we can offer you this hospital insurance. So if your son has appendicitis, it's going to be covered. If your son breaks his leg, or if you have to go to the hospital, these things are going to be covered. So that's how health insurance initially started, but it wasn't to cover your routine doctor visit. It wasn't to cover your routine X-ray, and that's really what has happened with in our society now with healthcare, is that it's employer or government sponsored normally, and so and everything's expected to be covered. Well, the problem with that is what happens when everything's expected to be covered is you have price escalation. First of all, you have surprise price, non-transparent pricing. So, go into your local healthcare clinic or your local hospital that bills insurance and ask them, what's the price to get a total knee revision, or whatever the procedure is. And you'll get the deer in the headlight look. Oh, well, we don't know. It's too complicated. And that's just absolutely not true. It's not that complicated. There's no reason we shouldn't have transparent pricing, but they can hide behind insurance companies and bill whatever they want. Of course, the insurance company doesn't pay whatever they want, but they can bill whatever they want. And that's what has made healthcare expensive, is having that insurance involved. Janet, do you have any questions or comments?
Yeah, I do. So just to kind of give some examples, we were taught from the political realm, propaganda, that if we didn't have health insurance, people wouldn't have health care or access to health care. And that's absolutely not true. Even prior to some of these things that came into effect, there were hospitals that offered services at the rate that a client could afford. And that I know I've seen even my own family history. So it was kind of a lie that we were told that, people were being turned away and not being taken care of. What ended up really happening is people couldn't barter and sell anymore. Everything had to be paid for via the IRS, putting that into effect. So, your local doctor used to exchange his services for some goods that benefited him or her. So that whole picture changed, that dynamic changed. But right now, even after Obamacare, right now we do still have cash services. They're out there. And actually, one of the best things about those services that are being offered, whether it's a direct primary care doctor or a doctor who the client pays directly to him cash, is that those services, are actually better.
Yeah, absolutely. Fast forward from the 1940s, when employers started paying for health insurance, again, not because the employees were demanding it, but because they had to, because the government put them in a bind to where that was the only way they could get new employees. So, but fast forward, let's see, about 20 years later, in the 1960s, and Medicare, the Medicare Act was passed. So, and the only way that Medicare was able to be passed was our wonderful president, again, FDR, back in the 1930s, passed the Social Security Act. And as much as people might think that Social Security and Medicare, are good, they are two of the biggest Ponzi schemes in the history of man. You will pay more in Social Security or Medicare than you'll ever get out, likely. Now, unfortunately, some of those programs have become entitlement programs, and people that have never paid into them are getting them, and it is bankrupting our country. But anyway, so fast forward to the 1960s, when Medicare came out, and the federal government started paying for healthcare. As you can imagine, the price of services went up tremendously, and the utilization went up. Here's a good example, and I write about it in my book. My book's called "Sickened: How the Government Ruined Healthcare and How to Fix It." #1 seller on Amazon a few years ago. Nursing home utilization went up 700% within a few years after Medicare passing. Why? Well, mostly because somebody else paid the bill, and there were, unscrupulous people that thought, well, we can make a lot of money on nursing homes, and we can just put people in nursing homes that maybe don't need to be in nursing homes, and we can bill whatever we want to bill. So the utilization went up 700%. So it wasn't just that the price was increased, but people were using services that they might not need because somebody else was paying the bill. And fast forward to today, how many procedures, how many lab tests, how much healthcare is actually unnecessary? I write about it in my book. 85%. 85% of all healthcare is probably not really necessary, and it's really only being done because somebody else is paying the bill. So think about how costly that is because somebody else is paying the bill. And remember who that somebody else is. It's the taxpayer. It's you. It's not the federal government. Remember, the federal government has no money. The only place they get money is to steal it from the taxpayers. So, and it got even worse in 2010 when Obamacare was passed. And this is also very important for health insurance. So the health insurance companies lobbied to get Obamacare passed. They lobbied very hard. Why? Because they were going to make a lot of money on it. And when you look what's happened since 2010 with health insurance companies, United Healthcare, look up United Healthcare stock since 2010. Look at them since COVID, actually. So it's in 2020 and what's happened to their stock and how much money they make. It's incredible. And I've got nothing wrong with people making money as long as it's transparent, Janet.
Well, so to give a real example too, in the time frame that Shawn and I came into pharmacy, we were talking about this last night. The prices of prescriptions actually were very competitive. I mean, Shawn worked at a retail Walmart, I worked at retail, and prescriptions were in thousands of dollars. They were actually very affordable.
Hardly any of them were $100. This is just 30 years ago, right?
Exactly. And as soon as Medicare Part D came into effect, those prices just went off the chart. So the amount that was reasonable and the market was keeping in check went from, $20 insulin to $1,000 products now that are out there. I mean, you can still buy insulin if you know how to get it at the right place. But the point is that the products that were being accessed went from affordable to unaffordable.
Yeah, absolutely. So back on the Obamacare thing, when Obamacare passed, there was a lot of regulations that were tied to it. Some of them were state specific. A lot of them were federally. Well, I guess Obamacare per definition was federally mandated. And it made it so everybody had to have health insurance. And it also, but it was certain kinds of health insurance. There had to be certain things on there. And one of them was preventative medicine. They had to, companies had to pay for preventative medicine. Janet has a great story about before we canceled our health insurance, because it was getting so expensive. Janet needed to do a colonoscopy, and I write about this in our book. And so before we canceled our insurance, we were going to make sure that it was covered, and then get the colonoscopy. So Janet, tell the story of your colonoscopy.
Right. So my family history is that colon cancer runs on both sides. So early intervention is something I really, in prevention, believe in. And so I was due for my next colonoscopy. And so, like Shawn said, we thought, okay, well, before we drop our policy and start something different, let's get this wrapped up and taken care of. So went to our local hospital to have this outpatient procedure done. And I show up in the morning, crack of dawn, and I end up being there all day. And by the time the day is almost over, they're like, well, you're going to have to come home and come back another day. And I'm like, no, this is a scheduled procedure. I took time off from work. I did the prep. I'm not leaving until this is accomplished. And so they accommodated me, which is to me actually really sad that I scheduled something and it took them that many hours to decide, well, I don't think this is going to happen after you go through a prep like this. Because in the consumer side, if I was the consumer, I would have had a voice, but they were like, oh, we're busy, we're running behind, this whole story. Well,
No excuses.
no excuse for that. Got through the procedure, went home. So we end up getting the bill, and the bill was over what, $5,000?
Yes.
And out of pocket was $3,600.
It was covered.
Yeah.
Yeah. Our part was only $3,600. It was covered all right.
Right. Fast forward to my next one, we decided to repeat the procedure, we were under, I think, Samaritan
Ministries, yeah.
a health sharing ministry. And so we knew that this was going to be out of pocket. So, we prepared for it. We looked for a place to go, and we found a place in Spokane that offered cash services. So I go in the morning in Spokane, which is about 2 hours from our home. So I go in, have the procedure done like at 6 o'clock in the morning, crack of dawn, right? And no kidding, my husband goes out to get the checkbook to come back in, maybe check his phone for a little bit, and they already have me in the recovery room.
It's done.
It was over and quick and fast, and I was home before
10 o'clock.
10 o'clock in the morning, which didn't happen at my local hospital that I'm 20 minutes away from, which is ridiculous. But the good news is that this doctor told me exactly what he saw. He, of course, sent the lab into the specimens into the lab to have it checked. But I knew that day what I was looking at immediately. It wasn't like my past two that were at the local place that took weeks and almost a month to get the pathology back. And then you had to make another appointment with the doctor to sit down and see what they saw. No, he told me right then and there. And as you should be able to do if you've done that many procedures in your life, you should be able to say this tissue looks this way or this tissue looks that way. And he was spot on. The point is that we paid out of pocket for this one. What was it? $1,600 or
$1,100.
$1,100 done over. So think about when I went to my local hospital that bills all this insurance and offers great care, it was 3 times the amount.
And we were insured. We had insurance.
Right.
And this is just one example of many that we can give of when you pay cash for a service, it's many times less expensive than your insurance than it would be through your insurance. A great example of this is MRIs. MRIs, for example, people talk about how expensive MRIs are. MRIs are expensive at hospitals and through insurance. MRIs aren't $5,000 when you pay cash. They're $500. So think about what a typical insurance MRI is. We hear this all the time. We tell somebody, hey, just pay cash for the MRI. Well, I've got good insurance. My employer pays for good insurance. So I'm going to, get this MRI. 6 months later, after prior authorization, they go through and they get this MRI. And then their copay is $1,000 because 20% of 5,000 is $1,000. And then they say, you're right, Shawn. If I would have just paid the $500, I would have been better off.
Right.
Exactly. And you wouldn't have had to wait 6 months with that knee pain, would you have? In general, for routine things, and MRI is a routine thing, paying cash for services, not only will you get not only will it be less expensive, it'll be better quality and it'll be better service. And that's because you're the customer paying the bill like any other industry. They've got to be good to you. When somebody else is paying the bill, your insurance company, they don't care about the customer in front of them. They literally don't. So what happened during Obamacare in 2010 is after they made all these regulations, there were some, with all these strings attached, there were some insurance companies that couldn't meet those regulations. So they pulled out of the market. So in Washington State, I don't remember the exact details, but there were like 7 or 8 different places that offered health insurance that you could buy in the marketplace. Well, after Obamacare, there were only 2. The insurance companies got exactly what they wanted. They could, now they have less competition. So
Right.
This is why they lobbied so hard for Obamacare. And, we just gave you an example of, how, things are covered under Obamacare. Another example of this is it's not under, we didn't have health insurance at the time, but the first time we had a claim under our health sharing ministry, because this is what we talk about. One of the fixes is don't use health insurance. Even if you got employer-sponsored health insurance, go to your employer. Go to your employer and say you don't want it. Tell them that you want the money, and you'll go buy what you want. We're a big believer in health sharing ministries. We've had Samaritan ministries, and we have Christian healthcare now. Janet and I pay $180 a month for our health plan, and we have saved, get this, over $250,000 over the last 12 years because of that. And we get to choose the doctor. We get to choose where we go. There's no in-network doctors. They don't tell us where to go. And by the way, just to let you know, when your insurance company tells you what doctor to go to, it's not because they're the best doctor. It's because they're the doctor that said they'd accept the discount. It has nothing to do with being the best doctor. So after Obamacare, essentially, it turned all healthcare, whether it's directly paid by the government or whether it's private health insurance. It's not private health insurance. It's government health insurance, because the government has told them what they can pay for at what rate. So if you have traditional type insurance, Medicare, Medicaid, or you have Premier Blue Cross, United Healthcare, whatever private healthcare that is, it's government insurance. I personally do not want the government dictating what kind of healthcare I have. And I definitely don't want an employer dictating what kind of healthcare I have. I want to dictate the healthcare I receive. We do have a comment from a listener and viewer, Rosanna Powell. There needs to be a big shift back to natural remedies. We thank you for commenting, Rosanna, and thank you for watching. Please share this podcast. We agree. And as pharmacists, we are two pharmacists that don't believe in drugs to treat long-term disease. It's a very powerful statement. One of the things I talk about in my book is, what is the fix? What is the fix for this? Well, the fix is kind of what Rosanna is talking about, is that, and not necessarily natural remedies, but it's how we take care of our bodies. In chapter 6 in my book, the fix, one of the quotes from me is, the best health insurance we have is not some kind of policy that we can buy or our employers can buy for us. The best health insurance we have is how we take care of ourselves. I mean, that hands down is the best health insurance we have. And if you take care of yourself, you sleep right, you eat right, and you move right, you're not going to need to access healthcare. You're definitely not going to need to access healthcare for most chronic disease. Most chronic disease, hypertension or high blood pressure, sleep apnea, most orthopedic surgeries, knee replacements, hip replacements. What are some other ones? Reflux disease, type 2 diabetes, of course. Those are all related to your lifestyle. If you change your lifestyle, those diseases go away and they don't cost you any money.
Right. And the reason we feel so strongly about this is, if you look at our population, right now we are living in probably the sickest population that we've had in the United States in decades. And big pharma hasn't solved that. Going to the doctor and running to the doctor hasn't solved that. I mean, we have to be responsible for our own bodies, and being responsible means taking on, the correct lifestyle, sleep, exercise, and diet. And to throw that out and say that that's not important, it's a fallacy, because food is medicine to the body. It gives the nutrients that it needs to operate and to repair. And the misnomer here is, in medicine, we call it standard of care. Well, I don't necessarily think standard of care means quality. Standard of care in the United States means that most people, by the time they're 40, are probably on at least 2 or 3, if not 5 medications for lifestyle issues. That's not a quality issue. I mean, that really puts us in a bad situation as we age. And really, these doctors or other prescribers, they aren't practicing under their own authority if they're in the network. They're really scrutinized and being told, if this person has this disease, then they need to be on XYZ. Well, how about we change that? How about we say, no, if I have a chronic problem, let's find the root cause of that problem and fix it. And then we won't be stuck taking something that has another side effect, and then we treat it with another drug and another drug. Because really, the people that live the longest and have the best longevity and have optimal health in life are those that aren't taking a handful of drugs every day. So, big pharma and their lie to us and insurance has really made our culture into this morphed health situation. If you look at Japan, Taiwan, Hong Kong, a lot of these areas that even the Scandinavian countries, if you look at their longevity and their quality of life, they live differently than us. They're not taking a pill for every ill. So we got to get away from that. We got to decide, hey, if this is going on in my body, what's the cause? What's going wrong? Instead of reaching for a fix. And really that fix is probably taking you down a very sad road.
And realize this too. So when you do seek healthcare and your doctor or clinic you go to, they bill insurance. If they bill your insurance, realize this, they're not working for you.
No.
They're working for the insurance company. That's who's paying their bill. So guess what? They do exactly what the insurance company tells them. And guess what insurance companies do? Drug companies they collude, they get in collusion with insurance companies to create a cartel to rip off consumers. Yes. So drug companies will get together with insurance companies. They'll create this formulary for their drugs and say, this is the drug you need to be put on your formulary for type 2 diabetes. You guys, if you've accessed the system, you know this drug is not covered. We got to change you to this drug. And this is what drug is the, on their formulary and what's covered. That's not because it's best for you.
No.
That's because that drug company and insurance company are giving each other kickbacks to give you that drug. It's not because your doctor thinks it's the best drug. It's because he's being told what to prescribe. So the best way to get out of it is find a doctor that doesn't bill insurance.
Right.
Then they won't work with the insurance company. They'll work for you only. And by the way, when you get bad service by that doctor, you won't go back. And that's why at our pharmacy, at Moses Lake Professional Pharmacy, we work with a lot of doctors that don't bill insurance because we realize the patients are going to get better care if they're in their care. Janet?
So to end our program today, we really want to share that, the best insurance in your health is yourself and how you take care of yourself. And we've talked about this probably and beat it to death, but it's the truth. You are in charge of your body. And I'm super excited that we are starting to focus in our country on health again, but just remember the government's not saving you.
No.
If you think that white horse is coming to save you in your health, it's not. It's your personal responsibility to do the things that heal your body and keep you healthy. So don't look to, the new administration for solving our health. Solving your health issues comes down to personal responsibility. And that is something that, yes, you might have to seek out help from a medical provider, a doctor or a practitioner to help guide you and give you the tools, but you're responsible. Nobody else, nobody can do this for you. And if you need to make changes in your life, it's up to you.
Yeah, that's absolutely right. And we started this podcast over 5 years ago with the goal of educating and empowering individuals to take charge of their own health. And, we talk about things like sleep, how important sleep is. And sleep trumps diet, by the way. We'll die without sleep before we'll die without food. So if you're not sleeping well, you're not going to be healthy. And then, of course, you have to eat well and you have to move. And eating is more important than exercise. You won't die without exercise, but you will die without food. So realize those things. Those are simple things. And we say it over and over again. Sleep, diet, and exercise are the three most important things. Focus on those basics first before you try any kind of fancy biohacking. Focus on those simple things. I'm going to in the comments in the video, I will leave a link to our What If Auto Insurance Worked Like Healthcare Insurance. And I'm also going to leave a link to my book. My book goes more in depth into this about the history of our healthcare system and how to find a health sharing ministry instead of using regular insurance, how to find a cash doctor that doesn't take insurance. My book goes all into that. I'll put a link in there to the Amazon link on how to buy that. And we thank you for listening. we really enjoy educating and empowering our listeners and viewers to take charge of their own health. So thank you for listening to Health Solutions with Shawn and Janet Needham. Tune in Monday, our regularly scheduled podcast, 12:30 to 1:30 Pacific Standard Time. I'm not sure who our guest will be, but it's going to be a good one. So thank you for listening to Health Solutions with Shawn and Janet Needham.